Lawmakers calling on Veterans Affairs Secretary Eric Shinseki to resign today. That's amid a wave of new revelations that VA hospitals delayed or denied care for veterans. This is your Wednesday afternoon news hub. I'm Sara Murray. 1,700 veterans. That's how many were waiting for a primary care appointment in the Phoenix VA healthcare system. None of them were included in the official wait list. These new findings and more from an interim report by the Inspector General of the Department of Veterans Affairs. Ben Kesling has been covering this for the Wall Street Journal, and he joins me now. Ben, thanks very much for being here.
Thank you.
So give me the big takeaways from this latest report that's out.
Well, this is just an interim report, like you said. The official report is really not slated to come out until August, so it's pretty surprising how much information was released today. About 40 pages of a report focusing on the Phoenix VA, but it also has broader implications for the VA system as a whole. The focus on the Phoenix VA came because there were allegations that the Phoenix VA was using unauthorized wait lists, were called secret wait lists, and they were keeping patients off of the authorized or electronic wait list. The 1,700 number, as you mentioned, was the number of patients who wanted an appointment but weren't on the electronic wait list and were being managed somewhere else or not at all. Some of them had trouble even getting appointments at this point.
Just an incredible number there. What did the report have to say about the broader implications? Are there reasons to believe that this is happening elsewhere?
The Inspector General said they've expanded the investigation. On the 14th, there was a Senate Committee on Veterans Affairs hearing, and at that hearing, the Inspector General said that there were about 26 places that the Inspector General was looking at. In this report, there are more than 40 now that they're looking at, and they mentioned that when they look into those places, if there's any civil or criminal issues, they bring it up with the Department of Justice, and that they have found widespread what they call systemic problems with scheduling issues at the VA.
Now, Ben, you had an interview with Secretary Shinseki earlier this month, and he seemed pretty adamant that he was not going to step down from his position, but it seems like there are more and more lawmakers now calling for his resignation. What kind of pressure is he facing now?
There are more and more lawmakers calling for his resignation, but for now, it's pretty much drawn along party lines. Today, just after the report was released, Senator John McCain called for the Secretary's resignation. Up to this point, he's not called for that. And the chairman of the House Veterans Affairs Committee, Jeff Miller, Republican from Florida, also called for General Shinseki to step down. One of the most prominent groups that's calling on him to resign is the American Legion. American Legion is the largest veterans organization in the United States with some 2.4 million members, and they called on Mr. Shinseki to step down at the beginning of the month, and they are the only major veterans group at this point who are calling on that. So while some lawmakers are wanting him to step down, he still has support, or at least isn't getting calls for his resignation from many of the major veterans organizations.
Now, Ben, really quick, I feel like there are probably a lot of people out there who are asking, how could this have happened? So how does this happen? How do people end up on a secret wait list, veterans, where they can't even get into their own veterans hospital?
Well, that's a question that the IG, the Inspector General, is still trying to figure out. But we had a piece on Saturday that spoke with the former Undersecretary for Health, Robert Petzel. Mr. Petzel was forced to resign Dr. Petzel was forced to resign by Mr. Shinseki about 2 weeks ago. And right before he resigned, he had a meeting with major veterans groups. And at that meeting, he said that he might have set too aggressive wait time goals. So the VA sets a 14-day wait time goal. If you come in, you want an appointment, you're supposed to be 15 days from the day you request it to the day you have an appointment. A lot of people think that is a very aggressive goal, very hard to meet, and has caused a number of officials to keep these so-called secret wait lists in order to make wait times seem lower so that they can make their targets. But there are a number of variables that go into this. Also looking back over time, the software system has been criticized. It's old. It was first introduced in 1985, sorry, and there are a number of factors into how this has come about, but it's not a new problem. It's been flagged multiple times.
All right, Ben, thanks very much for joining us. We're going to have to leave it there.